Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then aldolase reductase inhibitors. In the aldolase reductase inhibitor, the drug is epalrestat. Okay, this aldolase reductase inhibitor, which is epalrestat, this will inhibit the formation of sorbitol, and this will also prevent the complications of diabetes mellitus. Especially it will decrease the complication of neuropathic pain. It will decrease the complication of neuropathic pain like the sciatica. It is also used in patients with good glycemic control, and it is also used in patients with good glycemic control and limited microangiopathy.
thank you and thank you for watching.